What do employers really want to know about you? When you're a nurse, it can be hard to know how to prepare for an upcoming interview. Mind Your Head presents you a complete solution for this. In this video, we are going to see the frequently asked behavioral questions in the interview for a nurse, and best answer for them. So I will provide the 10 important and behavioral questions, and their answers, and the tips for you to make the best answer from your workplace experience and a mock interview with those 10 questions. Let's get into it.
In all the interview, the very first question from the interviewer is, "Tell me about yourself." This question is asked by the interviewers to start the conversation in better way, as like how we start the conversation with a stranger by putting, "How do you do?" You should not respond by telling your personal details like age, place, and family members. And don't tell your responsibilities or entire resume. It's better you can start by your professional ambition, the qualities you have, and the reasons you decided to pursue this career. Let's see an example answer.
Take your seat. I am David Mason, working as nursing manager.
Thanks.
Today, I am going to interview you. Can you tell me about yourself?
I am Alice Mila. I have always known that I want to work with children. When I entered the nursing field, this motivated my specialization. I've been a nurse for 6 years now, with the majority of my time spent in pediatrics. I worked in an adult medical trauma unit as a recent graduate. After that, I was allowed to switch to pediatric care by moving to the pediatric ICU. I advanced my nursing specialties to the pediatric cardiac ICU after approximately 2 years. I was able to care for high acuity patients here. The 3 steps of single ventricle repairs were handled by us. I'm now prepared to settle into a full-time pediatric ICU position where I can advance my nursing career.
The next question from the interviewer could be, "What are your career goals for the next 5 years? And how will this position help you to achieve them?" This question is frequently used by interviewers to consider your suitability for the unit's facilities. So, learning about the mission and culture of the workplace is the best way for you to prepare for this question. As an example, if you are interviewing for a job at a teaching hospital, you'll be expected to contribute to a learning culture. Other case, if you are interviewing for hospital, your contribution is to help raise their standards of patient's care should be expressed. Try to mention the facility's features which suit you and how this role aligns with your ambition or professional goals. Here's an example.
What are your career goals for the next 5 years, and how will this position help you to achieve them?
As soon as I got orientation, I'd like to get active in the department by serving on a committee that oversees quality improvement. At another hospital, I was a central line infection prevention champion, so I could see myself contributing to CLABSI prevention here. I would hope to begin receiving approval for my pediatric ICU advanced skills after about a year. Once I've accomplished that, I might see myself doing a study to earn my clinical nurse 3rd level accreditation. In the long run, I would use all of that experience to enroll in NP school and eventually become a family nurse practitioner.
Next question from the hiring manager could be, "Why do you want to work here with us?" Here, hiring manager wants to hear that you are open to learning, rather than that you already know everything. He wants to hear that you've done basic research about their facilities through articles or through social media. It shows that you're really interested in joining their team, so you can demonstrate your interests by discussing how their facilities will help improve your nursing career. Here's an example.
Why do you want to work here with us?
I am drawn to this pediatric ICU because I want to broaden my skill set as I train to become a family nurse practitioner in the future. Knowing that you are a center of expertise for uncommon diseases, particularly oncology, would help me understand more about potential health issues in the population that I might one day be treating. I saw that you were among the top 10 children's hospitals in the country last year, and I work on a team that upholds that quality. And I'd love to be a part of a team that maintains that standard.
Interviewer may ask you to describe the situation when you had to compromise to work with others. Nurse managers want to know that you are a team player. They want to hear that you are working well with others and willing you are compromise, especially when the patient's safety is at stake. Let's see an example.
Talk about a time when you had to compromise to work with others.
I once participated in a pediatric cardiac ICU quality improvement effort designed to update our standards of care for parent involvement for infants recovering from cardiac surgery. I was interested in developing methods that would enable parents to hold their infants sooner following cardiac surgery, together with a teammate. Some members of the team felt uneasy letting the parents hold babies who had intrusive lines and tubes. We then provided data from other cardiac ICUs that had successfully involved parents as soon as possible after heart surgery. After much debate, we were able to reach a compromise that permitted parents to hold their post-surgery infants with intracardiac lines, but not ET tubes.
Hiring manager may ask about the positive change that you brought into your workplace. He wants to know whether you're open to change and wants to see that you're willing to contribute to positive change for the unit. This question indicates the hiring manager's interest to hear about the projects you participated and their results. By knowing these qualities from you, he decides how much you contribute to his team if he selects you. Here's an example.
Give an example of what you have done or supported that brought a positive change to your work area.
A patient with a trach experienced an emergency when I was working in the pediatric ICU a few years ago, but the necessary supplies were not at the bedside. To ensure that we all felt comfortable using the items in these kits, I collaborated with specialists from a variety of fields, including respiratory therapy, pulmonology, and the medical team. We were able to observe a substantial decrease in event reports involving trach crises a year later.
Hiring manager may ask you to explain about the patient education provided by you and its outcome. As a nurse, it is likely that you will need to explain some complicated medical terminology and care instructions to your patient or patient's family. Due to this, it is usual in such circumstances to ask a nurse this behavioral question. Use the STAR method to describe a particular circumstance. Let's see an example answer.
Explain situation you provided patient education and what was the outcome.
I had looked after a baby who had an NG tube in for months and was having trouble getting off of it. When the medical staff talked to parents about inserting a G tube, they were unsure of it. The parents came to me as a nurse and inquired about what they were to do. I described to them the advantages of receiving a G tube and how it would improve the quality of life for their daughter. I described the procedure for inserting the tube and what to expect during recuperation to allay their concerns about the procedure. Once I addressed all of their concerns and misunderstandings regarding the process. In the end, the parents opted to proceed with the G tube implantation, and their daughter was discharged from the hospital much sooner. The interviewer may ask about your stress level in the workplace and how you control it. Demanding aspects of your job is very important. A clear explanation of how you manage the emotionally and physically in the workplace. Describe the techniques you've developed for stress relief in order to successfully respond to this question. Remember a time when you were in a difficult situation and summary what you did to prevent becoming overwhelmed. Let's see an example answer.
Miss Alice, what type of situation at work has caused you stress in the workplace? And what did you do to overcome the stress?
I can remember a time when I was assigned a 4-baby assignment after floating to the NICU. The thought of splitting my time between 4 patients when I usually only have 3 worried me. After receiving the report, I took a moment to myself and practiced the 4-7-8 breathing technique I employ to cope with stressful situations. I consciously reminded myself that these patients were healthy and that they would not be working together on a project if they were seriously ill. I switched from asking myself, how am I getting through this? I've got this too. I am a capable nurse, and if I was unable to manage this assignment, I would not have been given it.
The hiring manager may ask you to explain how do you deal with the patient who was upset. It's crucial for nurses to have compassion for their patients. Consider providing an example of a time when you encountered a challenging patient and assisted in improving the patient's outcome. If you are asked this question, Remember to mention if you gave additional resources to help comfort the patient. Here's an example.
Tell me about a time when you had to deal with a patient that was upset. How did you deal with?
I was caring for a 15-year-old child in the pediatric cardiac ICU overnight who would need heart surgery the next day. Within an hour, the patient called me into the room multiple times with different concerns. I sat down with him to see how he was doing, even though I was running late on taking care of the other patients I was supposed to be. It turns out that he was anxious about the procedure and had never been away from home before. I took some time to sit with him to inquire about his mom and family and about his pet animals. He then went to sleep and stopped calling frequently for the rest of his stay. This situation helped me to learn to look beyond patients' attitudes for underlying concerns.
Hiring manager may ask about your conflict with another staff member and how you resolved it. As a nurse, you will deal with a wide range of stakeholders. These might be other nurses, doctors, or other medical specialists, and you all wish to act in the patient's best interests. Hiring manager wants to know how you might handle conflict at work. When they ask you this question, your answer should reveal something about your personality and show how likely you are to get along with others in a group. Past actions frequently demonstrate how you will respond in similar circumstances. So, make sure to give a specific example, something you're proud of, or explain the lesson you learned from the experience. As compared to dwelling on the conflict itself, it is important to emphasize the resolution that took place. While responding to this question, emphasize your interpersonal skills, such as active listening, teamwork, flexibility, and the capacity to follow the chain of command. Let's see an example.
Name a time you had a conflict or disagreement with another staff member. How did you resolve it?
There was a period when I was admitting sepsis patients who required a lot of urgent duties to be finished. I knew what I intended to accomplish and in what order. I could sense the doctor was getting impatient with me when she entered the room and asked why I hadn't begun taking some medications. I was first irritated, but after taking a step back, I understood that the problem was that the two of us were simply not communicating. I explained my strategy to the doctor because he needed to know that I had everything under control. I inquired if there was anything I needed just about the plan after gently stating the order in which I intended to complete these activities. This demonstrated to her that while I was in control, I was also receptive to criticism. Since then, we've collaborated successfully, and I've always used closed-loop system of communication with the provider when discussing the plan and admitting patients.
And finally, the manager would ask you the trickiest question. Why should we hire you? You may surprise. Why would I claim that this is the hardest question to respond to? Most people are misled by this question's apparent simplicity, but it's not always as simple as it seems to present yourself as the best candidate above all others. In reality, for a nurse, your education, experience, and qualifications may be the same as those of other candidates on paper. What makes you unique, then? Because nurses are trained to prioritize the needs of others, putting oneself first can seem out of character. In order to successfully respond to this question, you must mention the unique skills and experiences you offer, and discuss why you are a good culture fit. Let's take a look at a sample answer.
Miss Alice, my final question for you. Tell me, why should we hire you?
I have a passion for pediatrics and improving children's lives. I am aware that being in the hospital may be frightening for children, so if I can ease their anxiety, I will know that I am doing my job well. I have a solid background in pediatric cardiology and trauma care, but I'm eager to find out more about the specialty illnesses this clinic treats. The teamwork and culture of learning I have observed in the pediatric ICU are things I strongly appreciate, and I would dearly love to be a part of that superior atmosphere. As you are mainly treating children diseases, I hope my passion and experience fits perfectly with the job requirements and expectation of this hospital. And I am sure that I will be the best choice for this position.
Okay, fine, I have done. Our HR manager will speak with you.
Thank you.
I hope you found this information helpful and that you're able to apply it as you prepare for your next nursing interview. Let us know you like the video by hitting the notification button for more career advice. And you can subscribe to our Mind Your Head channel right here for the upcoming videos about career development. Thank you.